The main reason that I decided about 5 years ago to incorporate this technology into my practice was I was at a point of my practice having used all techniques available to help the patient with periodontal disease, advanced infection, and saving their teeth as much as possible. And coming to a realization I need an additional tool to help me with that treatment, which would not only help them, but reduce the side effect that the traditional surgery caused, which was a lot of sensitivity, recession, and trauma to the patient surgically. So I decided to explore using this technology, which I was very well aware of 10 years prior, and I was monitoring it and following it and realized it was a good time to introduce it to my practice and give my patients an opportunity to benefit from that technology. I can say over 6 years prior to deciding to get involved with LANAP, I was invited to use the technology by two of the involved surgeons that have been using LANAP. And being very dedicated to provide the best care for my patients, I wanted to wait and see the research to show and to prove to me that this is a technology, a tool that would benefit my patients. And as I explored more and gathered more information, I discovered it is the right tool to add to my practice as an advanced technology for the patients, and it has been very beneficial. Introducing a new technology to my practice, I always worry about the potential side effects to the patients, which I've explored and I knew the potential side effects would be much less than the traditional. And at the same time, I wanted to make sure that the technology would be to the benefit of the patients, and bringing it to my practice was essential. At the same time, the training I got through LANAP was so intensive that made me become very confident in bringing it to my practice and providing it for the patients. The training process was very intensive. It wasn't just 1 weekend course. It was over a period of 3 sessions of training, and we had to, we were tested each time to show that we understood the technology, and we applied it on patients, live patients at the same time. So we were very well trained, and I was very impressed. And that truly prepared me to bring it into my practice and introducing it part of my tools of treatment to help the patients with their periodontal infection and disease. I've gone through many cases over the past 5 years, and these cases have had many ranges of gum disease, but in reality, as a specialist, as a periodontist, I only and mostly see very advanced cases where patients are at risk of losing their teeth, and the dentist refers the patients to me because they want to try to save the teeth. And I've had one case where the patient had gone to another surgeon who did not do laser surgery. The person had to go through traditional cutting the gum, opening the gum, do the surgical cleanup of the gum, and was in complete tears when she came to me because half of her face, the gum had receded, looked awful when she was smiling, and she came to me asking if I can help her with the second half that was infected, but reduce all that disfiguring of the gum. And I did the second half with minimal recession and improved her gum condition as good as and better than the left side, and she was just so happy. But unfortunately, the side that was surgically treated before could not be reversed. The damage was done. And that was for me an incredible experience to know how much I could help a patient and save that disfiguring process when periodontal surgery could do that. Traditionally, again, it's a surgery that we have all been trained as surgeons, but laser can be a great benefit to avoid those situations. With the referring dentists who have been exposed to this traditional surgery, they're very hesitant initially, they're not familiar with the process, but as they go through referring patients to me, and they see the outcome of the procedure where the patient hardly had any major discomfort. They come in a level of pain from scale of 0 to 10, 10 being worse. Usually with osseous periodontal surgical, cutting the gum is somewhere around 5 to 7. With laser surgery is definitely less than 5, average 3. Most patients have minimal or very little discomfort from the laser surgery because we don't cut the gum, we're not causing any injury to the gum. Therefore, the body has great potential to heal after the removal of the infection with laser. And therefore, we get an incredible biological repair and regeneration. That's so beautiful to observe. That takes time. It doesn't happen overnight. The body needs to heal over 3 to 6 months, at least, going through those biological maturation before we can see those beautiful results that I have observed with laser. The patients that are referred to me, when they know they're coming for laser surgery, they already know that it's going to be no cutting involved. So without any reservation, they're willing to go through the treatment of their gum disease and therefore to try to save their teeth. Prior to that, patients that were referred to me for periodontal treatment, they were fearful of coming to see me because they knew they were going to have gum surgery, which meant cutting their gums, which meant most of them tried to avoid coming to me and therefore delayed the treatment, which was not beneficial to their health of their mouth and their general health. And when they came to us, they delayed treatment because they were fearful of the surgery itself. So comparison, the laser has helped to make the patients be comfortable to go through periodontal surgical treatment, therefore help the patient get rid of the infection before they lost most of their teeth, or let the infection get even worse, which is not very healthy in general. I don't look at it as investment financial, I look at it as investment to the benefit of the patients, 100%. I have not increased my fees at all for having the tool. I've brought it in to the benefit of the patients. So that's the reason I've invested in the laser, to have it here for the patients. 100%. I would recommend highly for them to become LANAP certified. I would have them, if they have any reservation, to call me. If they have any reservation, to come and watch me do the surgery, have me show them the outcome of the procedure, let them realize the benefits of it, and hopefully overcome the expense of it. Understanding is to the benefit of our patients.